Today's Focus with Crystal podcast. Today's Focus with Crystal podcast.
Right. So welcome to today's Focus with Crystal. I'm so excited. We have a special guest here today. Angie from Winters Chiropractor and Physical Therapy.
Hi. Yes,
Hey, thank you for joining us today. We want to talk about pain. You know, on today's Focus, we talk about so many different focus depending on what I'm focused on today. And if my viewers know me, they know I've dealt with issues with pain from a car accident, and going to the chiropractor saved my life, as well as when I was my baby girl, who was 1 year old, who I sent to the chiropractor because she had a sudden infant death syndrome, and she got during her stay at the hospital, they did a lot of over medication, which caused her body to stiffen up. So, so I took her to a chiropractor, and it helped her so much on so many levels. We did the needling, we did a lot of different things. So what do you guys offer at Winters that people should be knowing about, especially now that it's cold, people ache more and body gets stiff more. Can you talk a little bit about that, what we can do to keep our bones loosened during the winter times until we're able to come see you?
Honestly, just, your regular get up and move. We typically recommend every 15 minutes, within an hour, getting up, moving, walking, stretching your legs, just kind of staying mobile. Because that of course helps blood circulation and help with your muscles from being stiff all the time. So just, regular bending at the waist, stretching, stretching your arms, stuff like that. A lot of everyday mundane things that people don't really think about, but it actually does help. So
what specials do you have going on right now at Winters that people should know about? Like, because a lot of people don't know a lot about chiropractors. They think like that's like the third last resort kind of thing. Hear about them last. And like I used to, when I was being a nurse aide for my daughter, it was like people would be like, a chiropractor, like why? And I'm like, why do they turn up their nose to chiropractors? Like, what is the battle here? Why is there a disconnect in the medical industry?
because I don't know, a lot of people think chiropractors and they're like, oh, well, they can't help me for this and they can't help me for that. Me personally, with one of my own experiences, I used to have chronic migraines, and I was living in South Carolina at the time. So my husband and we started seeing a chiropractor down there, and we did x-rays beforehand, and then we did x-rays after I was seeing them for a while. And a lot of people don't know that you're supposed to have like a 30 degree curves in your spine. One
Really?
right there at your cervical spine, which is right there at your neck, and then one in your thoracic spine, which is right in between the shoulder blades in the middle part of your back, and then another one in your lumbar spine, which is, of course, your lower back. Well, with me in the migraines, I did not have that type of curvature in my neck like I was supposed to. And after probably about 2.5 months of at least twice a week seeing a chiropractor, I went from no degree curve to right around a 20-degree curve. So that was a huge difference. And, for something so subtle and simple as going to a chiropractor, they help. And then that is what honestly made me a believer. And specials, we don't really have too many specials going on right now. I mean, we do see a wide variety of people, and we offer different things here at Winters. We do drug test and DOT physicals for like the Department of Transportation, and like small businesses, like for Boost Heating and Air. We have, Charles County that we see. So, I mean, we see a lot of people with that. We do, the chiropractic wise, we have a decompression traction table, which will help stretch your lower back and your neck for the people that are having like sciatic pain, lower back pain, even neck pain and stuff like that. Um, we have our therapy beds and we offer electrical stimulation. So there's like a lot that we offer that a lot of people don't think actually helps. But, every little bit helps. Every, smallest detail counts.
Well, I want to thank everybody who is watching us right now. If you have any questions for Angie, I'm sure she would love to help answer any questions you might have regarding pain. If you have any, superstitions in reference to going to chiropractor, she can address any myths that you might be,
Yeah, I'd love to.
know about. Because one thing about it is like pain is so. Today we be in front of our computers so much now. Like when you said 15 minutes, stand up, I was like, what?
Yeah,
Just like no way. Like I definitely have to listen to you now because I'm like, okay, I could find myself sitting at the desk for like hours working because I work from home from my computer. So it's very hard for me to like just stop sometimes. And sometimes I have to say, okay, you've been sitting down too long. You got to get up and stretch. How important is stretching and how important is that? Because when people are working at home and constantly sitting at their computers, are you seeing incline of people coming in because they work from home now? They're in front of their computers a lot.
Yes, ma'am. We actually, we have seen quite a few people for that, especially with working at home. You have to maintain a certain posture. But of course, once you get relaxed, you kind of slump your shoulders and then hunch over a little bit. And then whenever you get into the groove, that's just how you are. And then you don't realize it until you go to stretch. And then, of course, as you're stretching out those muscles in your upper back and neck, shoulders area. And then you don't realize how stiff you are until you actually go to move. And, you can stay in one position, and then of course your muscles are kind of tense and stretched there, and then as you go to move, you're like, oh, that hurts, and that's in pain. So even if you're on your phone, I know a lot of people that will just sit there and be on their phone and everything else, playing video games or media scrolling, stuff like that. Of course, even with that, put the phone down and stretch like every 15 minutes every hour.
When it comes to working from the computer. And I see that you guys offer weight loss too, therapy. Tell me a little bit about that. Weight loss and chiropractic, how does that go one hand in hand?
So it's the Invisired machine that we have that right now is only located in our La Plata office. It is not just for weight loss. It also works for aesthetics as well, for cellulite and stretch marks and, that kind of situation. Of course, there are certain areas that we are not permitted to use that on. It is a low level laser therapy. It's red lights. So, of course, we advise our patients not to look at the lights. We have goggles that, we can give the patients, they're like $5, but they are the patients and they're used for them and them only whenever they come in. But there's 3 different settings on it. It's good for different types of things depending on what's going on. And it's not necessarily like really too much related to chiropractic, but it was one of the things that the brothers wanted to venture off and see because it's a big thing now. But we do 2 different sessions. One of them, the first one that we would do is a 15-minute session just to kind of see what's going on with the patient, to see if they have any mild side effects. There's 12 paddles that we can put onto the patient in various areas: stomach, arms, back, thighs, buttocks for the cellulite, and stuff like that. So, of course, you would come in, fill out the paperwork, have a little consultation with the doctor, go over a few of the questions that they have for the medical history to make sure that you would be a good candidate for it. Because, of course, there are people that are not an ideal candidate, such as like pacemakers, cancers, open lesions, diabetics, stuff like that, because it can have an effect with the medication and their autoimmune system and stuff like that, which, is of course a big no-no. But the first session would be 15 minutes, and we would place the pads depending on what the patient would want. And then depending on how well they did, the next visit would then be a 30-minute session. So some of the side effects are, they're really, really mild. We have patients that have experienced like excessive thirstiness. A few patients have experienced a little bit of dizziness right after. Of course, one of the main side effects, which we all kind of want, is lack of appetite. So they feel fuller or not really having a desire to want to eat. One thing that we do caution them when they want to do the Invisired is to be mindful of what they eat, because even though it has the potential to burn up to 1,500 calories in one session, you want to be mindful that you're not eating and drinking those excess calories. So we recommend, water before and after, walking, light exercises, and stuff like that throughout the duration of coming in for the treatments.
The book with you, is it a walk-in situation, or is they can just book you online before we go into a quick commercial break?
A little bit of both. Sometimes we are a little bit busy, so we do prefer booking an appointment, especially for the Invisired. But other than that, yes, we do have a few people that have walked in, right off the street and say, "Hey, I heard about this, and what can I do to start it?"
On Facebook, what's your social media, your website, so people can support you, come and check out your chiropractic services?
So we do have a Facebook page, but we're kind of in the middle of revamping that. But our website is docwinters.com, and that's DOC Winters with an S.com. And then they can go online and book an appointment, of course, or they can give us a call.
All right. Well, I thank everyone who's watching right now. I'm so glad to have Angie on to talk about chiropractic services, how important it is, giving us some myth busters on chiropractic and how we can incorporate it in our everyday lives. So we're going to go to a quick commercial break.
I knew I wanted to relaunch my business in 2026, but I didn't know where to start. Then I found Crystal Hughes' 3-week business workshop. It's only $99 for 3 weeks, so affordable. I knew I wanted to relaunch my business in 2026, but I didn't know.
Welcome to the Crown Retreat, Utah, Alabama's new luxury bed and breakfast. Savor warm southern pastries, work in sunlit spaces, charge up your ride, and unwind. Welcome to the Crown Retreat, Utah, Alabama's new luxury bed and breakfast. Savor warm southern pastries, work in sunlit spaces, charge up your ride, and unwind.
All right. So we're okay, Angie. Exciting stuff. So what far as children, do you guys see children? What ages do you guys see? Thank you. We can't hear you.
Okay, sorry about that. So yeah, we see them pretty much from newborn to 18. I mean, obviously we see people older than 18 as well, but the doctor actually just adjusted twins earlier today, and
Wow.
Yes, it is absolutely amazing watching the babies come in. The parents bring the babies in because they're not sleeping well, or they can't turn their head to the left or right like most babies do because it's so stiff, or they, prefer only looking one way. There's multiple reasons that, of course, the parents will bring them in, but it's just so amazing that with as resilient as babies are, maybe 4 treatments tops, and they're good to go. The parents notice a tremendous difference with the babies after 1 to 2 visits. It's so amazing and humbling whenever the patients come in like the next time and the mom is like, oh my gosh, thank you so much, like she slept all night, or she's looking to the left now and she wasn't doing that before, and now that she's getting moving around, she has the motor skills and the hand-eye coordination, with not obviously crawling into walls or whatever, or walking. It's amazing to hear the parents state that their child had made a huge turnaround as quickly as they did.
What is one of the biggest myths about chiropractic care?
Can you say that one more time? I'm sorry, hon.
Yeah, what is the biggest myth?
The biggest myth. That's hard, really. I guess. Wow. I guess really that people say that they don't help, or that you have to have medicine to get better. And that's obviously not true. With the chiropractic world, some of the things that go wrong with a person on how they feel or what's going on, it could just be as simple as coming in and getting an adjustment because your spine is out of whack.
Okay. And it's just simple as that. So what conditions do you see most often, and what's your approach to treating pain without surgery or heavy medication?
I guess that what we see most often is lower back concerns. It could be due to sciatica, the main nerve in your lower back. Well, it's not really the main nerve, it's the biggest nerve. A lot of people coming in because they're having lower back problems due to work, bending, car accidents, stuff like that. And we've seen a few scoliosis patients and stuff. So what we typically do is when the patient comes in, they have a new patient packet, which is 5 pages. They fill that out. It kind of gives us an idea about what's going on with them, goes over any medications, past surgeries, falls, stuff like that. They talk to the doctor, and within, the discussion with the doctor, he decides the best treatment possible. For a lot of the patients, we like to see them at least 5 times before they do like an MRI. Or order an MRI or an X-ray, depending on what's going on. Some patients, of course, have already come in and they have X-rays or MRIs that they've had previously. That, of course, is a big help in deciding, what type of treatment to do, because then the doctors can look at that and kind of say, okay, well, you have disc bulging, or you have a, like a pinched area here, the X-ray looks like this, so this is what we're going to do. Some insurances that we take, that's going to decide if the doctor can do the prescription or an order for an MRI. Chiropractors, at least that I know of in the state of Maryland, cannot prescribe any medication. So they would rather try to do everything without that, because medication a lot of the times is something that just kind of covers up the symptom rather than go to the root of the problem. One thing that I like to talk to the patients about whenever they have questions is to think of your spine as the highway, because that is where like all the nerves and muscles and everything that run along your spine, your brain connects and talks with your body, and it does it through the nervous system and everything, and that goes right along your spine. So if your spine or the highway is messed up and you have a little detour due to scoliosis or pain or whatever, then of course the brain isn't communicating with the rest of your body the way that it was designed to. So therefore that's where the issues are going to come up. And it's just as simple as, and it's not always simple. Sometimes, of course, there are outside forces and other things that, cause the patient to have surgery or anything else, but it's just, I don't want to sound like a broken record, but sometimes it is just that simple. Anybody that is weary about it, I, advise and say, hey, come on down, just talk to us. We have free consultations, and, you're more than welcome to come on in, ask a few questions. And if you like what you hear, then great. We'd love to set up an appointment. If you want to do your own research and then, try to find out other answers to the questions that you may have, then, please feel free to do that. We, of course, don't turn anybody away. We love to, answer any questions and make them feel as comfortable as possible.
Well, Angie, what is a warning sign, or what are warning signs that should never be ignored when it comes to spine and joint health?
Well, consistent pain. Everybody has pain, the process of getting older and stuff like that. But anything that kind of stops you in your tracks. And of course, for everybody, that's different. People will have tinglingness down the arm or down the leg, and they're like, well, maybe I slept wrong. Okay, maybe, but then it could be something, like a pinched nerve, or as you were sleeping, or if you got into a car accident, or, you and your buddy were wrestling, something along those lines. It's always better to get it checked out rather than not get it checked out and it turn into something big. Even lower back pains. Sometimes it's just muscle spasms. You can do ice or heat depending on what's going on. Sometimes, ibuprofen is okay to take to help with what's going on. But if it's a consistent thing that doesn't go away, then, definitely get that checked out, because, whether it's by us or another doctor, it's better safe than sorry.
Now, how does chiropractic adjustment support recovery after accidents and physical trauma?
So accidents, we of course see auto accident cases, PI cases, we see worker comp cases. Coming in, let's say you got into an accident and you were hit on the passenger side. Well, the force of that, of course, is going to potentially give you whiplash or strain with the muscles and everything else surrounding this. Or whether you were stopped, either way, have that jolt. And just like a centrifugal force, it's going to throw stuff out of whack. If I'm going to take, some slime and throw it up against the wall, in my hand, it's perfectly fine. But if I throw it up against the wall, it's going to shift, even for a slight second, but it's going to change it. And then for humans and our spine, whenever it changes due to the force, it's going to take another force to try to put it back into place. So like clay or whatever, when you move it or you're molding it, you're changing the shape, and you've got to try to change it back. So chiropractic helps in changing that back, because they're working with the spine, trying to manipulate it to move it back, because it is a flexible type structure. So I see you trying to navigate the website for our services. Why can't it load that video? You there, Crystal? So I can give you a little bit of backstory on the brothers. Um, they are twins, identical twins. Um, they were born in Minnesota and moved to the Northern Virginia area, like right around 97, and settled there for a short time before moving to Maryland. They've been in practice for over 20 years. They started their journey in Waldorf for a little while before branching out on their own and making a name for themselves. We have the two locations. One, of course, is in Charlotte Hall, and the other one is in La Plata. We're open Monday through Friday. Both both brothers, of course, specialize in chiropractic. The physical therapy portion is privileges. So they're a chiropractic first with physical therapy privileges. Paul Winters, the brother that I work with, he specializes in, the chiro and PT, but he also does drug screens, alcohol testing, DOTs, and so much more. Where Patrick Winters, his focus is more on the chiropractic and physical therapy side. Both of them are equally knowledgeable in all aspects of the chiropractic world. They are more than welcome to answer any questions that anybody may have. They're very friendly. It's a they're very friendly and family oriented men. And they just like keeping their community and everyone else in this area healthy. And I believe that Dr. Patrick was the one that wanted to look into becoming a chiropractor first. But because of the identical twinness that they have, then Paul decided to join the venture as well. And Patrick, of course, is the older one by 15 minutes. And they also have other brothers and sisters as well, where their family is back in Minnesota. So I just got the message from Miss Crystal saying that there's technical difficulties. So of course I can't hear her right now, but I guess everybody else may be able to hear me. Hold on, I just got something. I think we are going to reschedule.